Dr. FATIMA KAKKAR is an infectious diseases pediatrician at the Sainte-Justine Hospital, and she joins us now. Thank you for your time, Dr. KAKKAR.
You're very welcome.
So let's find out a little bit more about this. Moderna saying today, okay, we have determined that it is safe for under 6-year-olds. What do we know?
Yeah, and it's really great news that you said it correctly. So it starts at 6 months all the way up to 6 years. We've already had the approval for the 6 years to 11 for both Pfizer and Moderna. So this is really their study data that showed that the smaller dose that they gave was effective in producing an immune response. And it's really great news because people might have heard from the preliminary Pfizer data that their 2-dose vaccine didn't produce a strong enough response. So it's really positive that the Moderna vaccine is really going to be the first one we have available to the under 6.
Okay, and what kind of dosage are we talking about? Because when my daughter was finally eligible, I think we found out it was a half dose. What are we looking at for this age group?
So this is a quarter of the adult dose. So it's interesting with Moderna in that the adult dose is 100 micrograms. So this dose that we're giving is 25 micrograms. And it's half of what the adult booster dose from Moderna. So it's a bit complicated, but the adult booster dose from Moderna is half of the regular dose, 50 micrograms. So it's a quarter of the regular dose and half of the booster dose.
How long does it take usually when we hear from a company, because again, this news is coming from Moderna themselves, how long would it then take to potentially have Health Canada approve it, Dr. KAKKAR?
So in this case, it does look like it's gone for the FDA approval, and so we're usually just a few weeks after FDA. So I think we're looking at least 2 to 4 weeks before Health Canada, and then NACI is going to look at that data and make their firm recommendation. But I think given their trial data and given what it looks like, and it really does look like it's very efficacious, I think we're looking at a minimum of about 2 to 3 months before we have this vaccine available.
Okay. And then with regards to side effects, because that was something we heard so much about for adults, not, much less so with the Pfizer for the 5 to 11-year-olds. Where are we at with that, with this one? Do we know anything?
So what they reported in their trials, they didn't have any of those cases of the ones we've heard about, myocarditis or multisystem inflammatory syndrome. And it was really myocarditis, even though it was very rare, it was reported in adolescents and older adults, especially younger males. And we think it's related to the higher dose that was used in the adults and the changes that happen with puberty. It's really important to note that we didn't have any of those cases reported in the under 12. And so it's very unlikely that with that small dose that we're going to give in that under 6 age group that we would have any myocarditis, because it doesn't fit with what we know of the cases of myocarditis we've had so far. So nothing reported in their trial, but people will realize that the trial was small. It was only 6,700 participants. But without any signal and without really any plausible biological reason to think that there is, I think we would be very reassured with this small dose without side effects.
And there was a fair amount of hesitancy with regards to the latest age group that was eligible. So the 5 to 11-year-olds actually. Yes. Do you suspect that will be even worse in this younger age group?
I think what's happened is a lot of people have had COVID. A lot of children have had COVID. So I think especially when that 5 to 11 became approved, people said, well, my child has had COVID. Do I really need that vaccine? So I suspect it's going to be the same for the under 6. But I think what I want people to consider is that, as you've just mentioned, we're not over COVID, and it's going to continue. And so I understand that people want more data and maybe will want to wait, but I do urge them to consider it when it's approved, and also just to really consider the health of their children, because I still have hospitalized children with COVID, and we do see, severe COVID in children with underlying conditions and risk factors. So every parent will make their individual decision, but I definitely want them to consider that COVID isn't over and that we don't have yet the same effective treatments that we have in adults. So this is another long story, but we don't have the same antivirals and monoclonals that we have to effectively treat adults as we have in children. So this is really, I think, our best bet for preventing severe disease in children.
What happens now with respect to what we're talking about, looking at a sixth wave, this BA2 variant now, something of concern? What about that with respect to this vaccine in children?
So it is here, and just looking at the numbers I'm seeing in hospital, we are seeing these cases. I don't think we can deny that we might be on the edge of another wave. And so, the children first who are eligible, the 5 and above, I do urge them to get vaccinated, and especially if they have an underlying condition, because that's what I'm seeing in hospital is children with these conditions who are not vaccinated. I don't think that we're going to have the under 6 approved in time for the imminent sixth wave, but we're looking at potential waves coming again in the fall and the winter of next year, and we know that just having a little bit of vaccine on board, having that antibody production, it might not stop you from getting COVID, but it'll prevent you from having severe disease, and really that's our ultimate goal.
I'm curious about under 6 months. Our producer just had a baby 2 weeks ago, and she's kind of like hunkering down and just being very protective. Would there ever be any hope to vaccinate babies under 6 months, or for the time being, it's just that's what is safest to just stick with what we've got?
That's a great question, and actually, the great news about that is that babies under 6 months, the reason it's so hard to vaccinate them for COVID is because they generally have their mom's antibodies, which they get to the placenta. So the best way to protect the under 6 months is for moms to have been vaccinated and to have gotten their booster shot. So even if they were vaccinated before pregnancy and they have their circulating antibodies, these are going to be passed on to their babies. So their babies will be protected. So if you're worried about your baby, please get vaccinated, mom, and you'll have protection for your baby.
Can I just ask, are you still finding, I remember we were talking about this at the outset when we finally found out that children could get vaccinated. I mentioned, Natasha, about you worrying about your daughter when she could. Are you still finding hesitancy among parents wanting to do this, or enough of them that it's a concern?
There is, I would say, and I'm very biased because I see the patients who are here in hospital and in my clinic, and in hospital there is, the ones who've gotten COVID have been hesitant. And a lot of it was, this thinking that children aren't severe and they wouldn't get very sick from it, and this initial hesitancy that there not being enough data and risk of side effects. I do want to say that the data has changed so much, and we have so much data on over 10 million doses in children. So on that, I think we can be very clear that there's no safety signal. And on the risk, again, it's an individual decision, but I do really urge parents of children with chronic conditions to consider this, because there is a chance they can end up in hospital, and this can be avoided with the vaccine.
Okay.
Great advice. One last thing I'm just curious about. There seems to be like brand preference, if you will, when it comes to vaccines. So everybody seems to be just more confident and have more trust for whatever reason in the Pfizer brand. I'm wondering, with this being Moderna coming out with it for the younger kids, would that be an issue at all? And is there any basis in reality for that brand confidence?
No, and I wish we hadn't gone that route. They're very similar vaccines, Pfizer and Moderna, and really, the lipid nanoparticle is the same. The biggest difference is the dosing. And so in this case, it's been an advantage because Moderna chose a higher dose for the under 6 and their vaccine worked.
Okay.
So it's really just a dosing question. There shouldn't be a preference as far as adults. But for children, because Moderna went with that higher dose initially, its vaccine worked. And so I think for children, it's going to be a preference for Moderna simply because it looks like that 2-dose vaccine worked, whereas Pfizer is likely to be a 3-dose, which might be less practical and less desirable for that extra shot to have that same level of protection.
All right.
Thank you so much. Great advice,
absolutely. Thank you so much, Dr. Kakkar. Appreciate it.
You're very welcome.
Dr. FATIMA KAKKAR, she is over at the Sainte-Justine.